This is going to be my video on patient registration and just being a new patient in the clinic. So you would fill out these papers, which consist of patient demographics and patient history and a lot of different other things. But before we go over that, I'd like to talk about how first impression is key into this, and just making it onto the patient and just handling everything with a smile, you know, and a good attitude. That's key. So you would give that to the patient. Okay, when you hand the patient the packets, this is what they will be seeing. This is the patient information and consent form, which consists of the patient demographics and consent for treatment, workers' compensation, and consent for medication. This is the medical history, which they would write their name again and their date of birth, their allergies, the medications and the reactions, any major illnesses such as hypertension, which is high blood pressure, diabetes, cancer, any others. And this is where you would fill out the if it's current, past, or if you have any at all. Any surgeries, family history of, again, hypertension, diabetes, any cancers, and of course you'd go on with the siblings, and of course social history, which is drinking, alcohol, tobacco use, any substance abuse. Can you turn the page, please? And these are the medications and dosages a patient might have. If the patient doesn't have any, of course they would sign that. Any other information such as their pharmacy, the pharmacy name, the address, their last menstrual period if they are pregnant, and of course patient acknowledgement and their signature. This is the notice of privacy practices, which is just how a patient's information is private within the clinic. So that's HIPAA and a lot of other things. And this is how the information would actually be released. So you would give us the information and who it would be released to, such as spousals or pharmacies, other doctors, anything pretty much. And this is the financial policy disclosure, which is just all how your financial stuff is handled, whether it may be your insurance information or anything else that consists of that. And here's your insurance verification. Here's the advanced beneficiary notice of non-coverage. This is what your insurance doesn't cover, such as anything and like Medicare and Medi-Cal. This is where you'd put it, and here's your signatures and such as other things that consist of it and how it would be handled within the clinic. And here's the physician's arbitration. And the last page would be the advance directive, which is what would be done if you didn't have choice to it, such as like CPR, or like if you were dying and there was another directive in this decision. This is where this decision would be noted and your signature would be there. And after you get all the papers back, you just want to make sure that everything is signed and dated at the correct date, and You also want to make sure that you have the patient's information, like such as their name, date of birth, their insurance information, and their verifications.